Hi, I'm really excited to be bringing you this video on breastfeeding. Breastfeeding is such a passion of mine, and I just want to ensure that you get the right information because you need to enjoy breastfeeding your baby. It's not always seen as second nature because some moms have no idea and they really struggle when it comes to breastfeeding. So we're going to talk about breastfeeding, all right? My name is Shiro Shera and this is Nurturing Moms. The idea that mom and baby are born knowing how to breastfeed is not entirely true. What's true is that breastfeeding has to do with instinct, it has to do with a reflex, and it has to do with a lot of learning. And through lots of practice, you learn. So when I talk about instinct, the mom has an instinct to take her baby and put the baby on the breast so that she can feed her baby. The baby is born with a sucking reflex, so they are born knowing how to suckle on something. Learning, because breastfeeding is not easy, but once you learn how to do it, you need to practice and practice and practice. The more you practice, the better you get at it, all right? Now, the key to breastfeeding is getting the latch right. Honestly, if you get the latch right, then most or all your problems are gone, all right? The reason I say that is because I've supported so many moms who have struggled with breastfeeding. They have cracked nipples, they have painful nipples, they have bleeding nipples, and sometimes it takes them long to look for support or look for help because they feel they failed. They're like, I thought it's natural to breastfeed, I should be fine and know what to do, but I'm struggling. What I want to tell you before I even go any further is please get help early. The earlier you get help, the better it is for you. So you avoid having this painful sore nipples and you just decide, you know what, I'm not going to do this anymore and stop breastfeeding. You need to enjoy and love how to breastfeed. So I'm going to walk you through steps of what to do to ensure that you get the right latch. So let me introduce you to my friends. I've got Tuma here, all right? This is my baby and this is my model breast. So I'm going to be using these two to show you how to put your baby on the breast. The first thing you need to ensure, okay, so this is my breast, this is your nipple, okay. If you don't have a nipple protruding like this, I will talk about it in the next video to know what you can do to those nipples. However, this is a normal nipple and this dark area here is called the areola, okay. So when you're latching your baby on the breast, most of the areola should be in the baby's mouth. Now, being Africans, we do have big areolas, but even if yours is small, most of it should be in your baby's mouth. If yours is as big as my model breast, at least an inch of it should enter the baby's mouth, okay? So I'm going to show you how to hold your baby. The first thing I'm going to say is if you decide you're going to breastfeed on this breast or this side, then you're going to use this hand to hold your breast, okay? And you can see what I'm doing. I'm holding the breast like this. I'm not holding my breast like this, okay, with my fingers. We call this the scissors hold. We don't encourage this. And why? If you hold your breast like this, then I've just said you need to ensure at least an inch of the breast shouldn't be in the baby's mouth. But if I put my fingers here, then the baby is not able to open their mouth wide enough to get most of the areola inside their mouth. So we call this the C hold. A C hold, you hold your breast this way, okay? So I'm going to choose to breastfeed on this side and I'm going to hold my baby, and this is how you hold your baby. It's the easiest to do, okay? To hold your baby like this, supporting their back and using your two fingers if you need to move their head, okay? Now this is a cross cradle hold. I'm going to show you, and I'm going to show you the usual hold that we do and see the difference. So this is my breast. So this is baby Tuma, and I'm going to bring baby Tuma to the breast, ensuring that her nipple is right, my nipple is opposite her nose. So always remember, nipple to nose, nipple to nose, nipple to nose. Put your nipple opposite her nose, all right? And then wait for her to open her mouth wide. So you can either, if her mouth is closed, you can either tickle her lips so that she reflexes and opens her mouth to take in whatever that you're putting on her lips, okay? Once her mouth is wide open, then you put her, once her mouth is wide open, put her on the breast and you draw her close to you. So you've got to do it quickly. If you do it slowly, she'll only attach to the nipple. We don't want the baby to use the nipple as a straw. If she does that, then it's going to be very painful and it will cause your nipples to be very sore. So ensure Once she gets it right, her mouth or his mouth is wide open. Then quickly draw them close, near. Now you can see my hand is supporting their back. Okay. Once the baby is on the breast and suckling well, then I can release this hand and put her like that. And my hand is right there on her palm, supporting her well. Okay. Once they're bigger, they should actually be right opposite the elbow when they're feeding. All right. Now I'm going to show you what we normally do. This is what you see most women doing. This is the breast and this is the baby. So I'm going to hold my breast with this hand and do like this. Okay. What's comfortable for me right now is to sit like this. Okay. But the baby is so far away. So I've got to move my shoulder like that. This hurts my shoulder and it will hurt your shoulder. It's not comfortable. So what I'm advising you to do is use the cross cradle. So get your baby, hold her like this, and when they're tiny, newborns, this is very comfortable for you and her. It's fine because you're supporting their back. Remember, you're not holding the head because there's a very soft area here, and the same one that's at the front of the head called the fontanelle. So hold the baby, get the baby to latch, ensuring most of the areola is in their mouth, and then once you want to get settled down, move your hand and you can do that. And you can do something else with this hand. I hope we got that. I hope you've enjoyed watching that video and have an idea of how to latch your baby on the breast. Remember, learning how to breastfeed, the key to breastfeeding is the latch. Once you get the latch right, most of the other things should come on naturally. My desire for you as a lactation educator is to enjoy breastfeeding. Breastfeeding is beautiful. May you enjoy it and may it be fulfilling for you and your baby. We do offer breastfeeding support. So if you are struggling with breastfeeding currently, please look for us. Our social media platforms are below. You can text, you can call, you can email, and I'll be happy to support you. We also do childbirth classes where we cover 2 hours of breastfeeding. So if you want to cover breastfeeding as part of your childbirth class, that is also offered as a package of the childbirth preparation class. And remember, if you don't want a group class, they are private classes. This is Shiro Shera with Nurturing Moms.